So what about money? It's quite a controversial topic and quite a controversial area, and I think it is relevant to part of the discussion about jobs in Australia. And what is important to realise is that individual states have individual enterprise bargaining agreements. So, and that exists a little bit in the UK, where each nation can decide what it's going to do in terms of the contract, but the structure and basis of the contract is largely the same. The general principle that you should hold in mind is that the advertised salary that you will see is really the minimum salary that you should expect. But there are very generous out of hours and additional supplements that you get to your salary. And one of those things is that you have to learn this a little bit as you go in Australia, because you actually have to start filling in timesheets every 2 weeks of exactly every hour that you've worked, every callback that you've had, in order to be paid appropriately. And what you very clearly realise is that your basic salary is only for 76 hours per fortnight. But what is very clear is that if you're working a 1 in 3 on call, you're working from 7 or 7:30 in the morning to 5:30 at night or 6 at night, you very quickly exceed the 76 hours. So you get time and a half for every hour paid beyond that. If you're called back to the hospital while you're on call, you get paid time and a half for 3 hours every time you're called back within that 3 hour period. You get paid additional for Saturdays and Sundays. And if you don't get 8 hours rest, you're paid time and a half the following day until such times you're led away. If you work more than 8 consecutive days, you're paid time and a half for each additional day worked. So it doesn't take a genius to work out that actually the supplements to your salary end up being potentially more than your base salary itself. On top of that, if you are working in private, you have the ability to charge private assisting fees, which can be up to 20% of the procedure fee. The corollary is that if you do happen to have a quiet on call, you get paid pretty much bugger all. So it is in your interest to work. And the other thing is that professional development still exists in Australia. And it's, for people in the training program, it's $8,000 per annum. But if you're there as a fellow or non-accredited registrar, it's $4,000 per annum in South Australia at the minute. As consultants, the salary makeup is again very different. And the basic salaries in South Australia for consultants vary from $178,000 to $256,000 per year. And the exchange rate at the minute is about $2.10 to the pound. So if you divide by 2, it gives you a basic comparison. In surgery and the surgical specialties in South Australia, you automatically get a 30% attraction and retention allowance. So you get 30% added on to your base salary straight away. I get 9.5% of my base salary added on just for providing an on-call roster. And I have a right of private practice for up to 65% of my base salary. So if you're working at my level as a full-time equivalent consultant, that's a base salary of $285,000 per year, with the ability to earn up to another $132,000 within the public sector from private practice. But I'm also still paid for any work that I actually do on call. So for example, if I go in and see a patient, I'm paid, again, similar to the junior doctors, that I'm paid a time and a half for a 3 hour callback to go in and review a patient. But if I operate on call, I'm paid the CMBS codes. And this is where the whole system in Australia starts to get incredibly complex, is that these codes are essentially the fees that you would charge a private patient for performing a procedure. But you get a 30% supplement. So if I did a FemPop bypass while I was on call, I would earn another $3,000 for doing the FemPop bypass. Now this is something that's just completely alien to how the UK works and how the salaries are justified, and it does mean that your remuneration in Australia is significantly more than what it will be in the UK. You've got to take that in context though of cost of living and other expenses, and I'll come into that a little bit later whenever I go through some of the training expenses that exist. But what is very clear is that the salary increases that you get in Australia far outweigh any potential difference in the cost of living. As a consultant, I actually get $21,000 per year for professional development, which can be used for anything, including travel to conferences, buying a laptop computer, buying an iPad, buying an iPhone, journals, and my professional fees. And compared to what consultants get in the current NHS, this is just ludicrous. And so I'm very privileged to actually have that as an additional sort of aspect of my salary. Then there's the tax systems in Australia, and they are again incredibly complex, and I make no play to try and understand what the tax systems are. What became clear to me was that there was this process called salary packaging, which I tried to understand, I tried to get people to explain it to me, but essentially what it means is that in addition to your normal tax-free allowance from your income, that you're also allowed to salary package $9,049 per year on top of that, which essentially means they take it out of your pre-tax salary and then put it straight back into your bank account. So you essentially get $9,000, an additional $9,000 tax-free. Whenever I went across, I bought a new Nissan X-Trail, and the car lease for that was also tax-free. So my car is being paid off tax-free. And in certain states, entertainment, including all meals and drinks, certainly my wife she is a nurse working in a private hospital, is allowed to salary package almost her entire salary as entertainment allowance. So if we go out for dinner, she pays with her credit card, which is her tax-free salary. It kind of makes me wonder how the Australian economy actually runs if nobody's paying any tax, but it seems to work. And then on top of that, all of your professional expenses, so whether that be exams, professional subscriptions, travel to conferences, conference registrations, anything that you do can be tax deducted. So the tax breaks are also much higher in Australia as well. But I don't get any danger money payment. So just talk a little bit about the lifestyle, and certainly in Adelaide we have the Adelaide Fringe Festival, which is the second largest fringe festival outside of Edinburgh in the world. And sort of between February and March every year, the city comes to life, and there's really a very active buzz around the place. We have the Calypso 500 car race, and we have lots of things that we can do. It also helps whenever you look out from your hospital and that's your view, which is actually, despite all the trees that you can see, it's actually quite a densely populated area. It's just that they all live in bungalows, so all you can see are trees. Down to the beach, which is only 5 minutes away by car. Gives you the opportunity to travel, and certainly there's a lot of the outback that can be explored, both locally and also by flights. So it gives you that opportunity to explore the countryside as well within what you're doing and within easy access of the major cities. You do have your certain pitfalls, and these are all actually photographs that I took around our area, which are both cuddly and friendly and also quite dangerous. But it adds a sense of variety to your life that you don't necessarily get here. Interestingly, I've not actually had to treat any patients in Adelaide with snake bites or redback bites, but while I was working in Bundaberg, I treated 2 patients with brown snake bites, both of whom had cardiac arrest as a result. For those people who know me, they'll know that I have an interest in food, and it's given me an opportunity to truly explore the whole paddock to plate philosophy in terms of what we do. And I've been making all of my own small goods with a couple of friends, one of whom happens to be our renal access nurse. I was making my own black pudding and recreating the Red Hand of Ulster. But it gives us an opportunity to do things that we wouldn't otherwise normally have access to. There are things that are slightly different. Bacon is not the same. And that was actually my driving force behind getting our own pigs, was I needed to make my own bacon because the bacon in Australia is pretty rubbish. You do miss your soda bread and potato bread, so you've got to make your own. And Christmas Day, as you can see from our Christmas Day meal on the right-hand side, is just not the same in Australia. Whenever it's 40 degrees, it has a very different flavour and feel to it. It gives us an opportunity to explore things, and this is one of my really good friends, Justin McNamee, who happens to own this little winery in McLaren Vale, which is a really dangerous thing, having a good friend who's a winemaker. Unfortunately, we get too much free access to his wares.